Hi, I'm Tamsin Marshall from Beauty Goss, and I'm here with Dr. Teresa Cattin from Faceworks. Teresa is a cosmetic physician who has been training doctors in the use of Botox for over 10 years. She's on the advisory board for Botox and Juvederm, plus she's the president of the New Zealand College of Appearance Medicine, and she has her own fantastic skincare range called Faceworks. First of all, can you please explain what non-invasive cosmetic procedures are?
Sure. Non-invasive cosmetic procedures are also known as cosmetic medical procedures, and it refers to all the cosmetic treatments done by a doctor, but do not involve surgery.
Which are?
Well, the most common, I think, worldwide would be Botox.
Right.
That's got to be the most well-known.
Yeah.
Probably rapidly followed by dermal fillers. The difference is that Botox is a muscle relaxant, so it temporarily relaxes muscle, so that any lines over that muscle will then smooth out and repair, as opposed to a dermal filler, which is used more for plumping skin, for softening lines. So the two are used together, and they complement each other.
Cool. Now, I know that you travel quite a bit for work and you're attending various conferences around the world, and you've just come back from Monaco. What are the key trends happening for appearance medicine overseas and here?
Look, the key trends as far as products go, the growth of Botox continues to just skyrocket worldwide. It's incredible. And that would be followed closely behind by the hyaluronic acid group of dermal fillers. As far as trends in treatments, as far as trends and techniques goes, there's a trend away from just superficially filling in lines to actually replacing volume that's lost in the face with aging.
And why do you think more and more New Zealanders are choosing non-invasive cosmetic procedures?
You know, more and more people worldwide are choosing non-invasive procedures, and I think it's because they work. They're effective, they're affordable, they're safe, and they're giving people the very natural result that they want, that people want.
And I guess you don't get the same downtime from, say, surgery or anything like that. It's sort of come and go.
Absolutely. You can literally go back to work as soon as you've been treated.
What are the common misconceptions around appearance medicine?
There's a few. I think probably the most common misconception relates to price. A lot of these treatments are far more affordable than people seem to think they are. The other common misconception that I see in my clinic is associated with the level of comfort. People think they're going to be uncomfortable procedures and are pleasantly surprised at how comfortable and quick a lot of these procedures actually are.
What are the risks associated with non-invasive cosmetic procedures?
In my clinic, I only use products that are very safe and are registered and are very well tested and have a great safety profile behind them. And I think the serious risks in this field occur when people don't go to a bona fide clinic. They go to a practitioner perhaps who hasn't been trained properly in these procedures, or may even go to a clinic where unregistered, untested products are being used, and that can be a real health risk.
So what steps should someone take if they want a non-invasive cosmetic procedure?
They have to do their homework. They need to firstly find a practitioner that they're comfortable with, and the internet's a great source of information for that. They need to start with a consultation. Go to a clinic, sit down with the doctor who's going to treat you and talk about what is bothering you about your face, and a good practitioner will be able to advise you on what you should treat and what you should leave alone.
So what's the most common feedback that you get from someone that has had this procedure?
You know, the level of patient satisfaction for these procedures, in particular the Botox and the Juvederm, is just incredible. I get really positive feedback. People talk about feeling better about themselves, increased confidence, increased self-esteem.
Yeah, it must be quite a nice side of the industry that you're in. You've definitely chosen the best part of medicine.
I think so too.
What do you personally really enjoy about the appearance medicine industry?
I love my job. It's a wonderful field of medicine to be in. I mean, it's always great to help people. It's always rewarding to help people. But it's a very exciting field of medicine as well. There's new techniques, there's new treatments coming out. And on top of that, it's also one area of medicine where you have to be an artist as well. And a good cosmetic physician will be able to look at a face and see the natural beauty of each face and know how to bring out that natural beauty, but stay true to the character of the face as well. And that's the key.